Welcome to the first Thought Talk strand of the Galway International Arts Festival Autumn Edition. This unusual version of the festival is coming to us this year against the backdrop of COVID-19, which has hit arts events particularly hard, put a lot of people out of work, and stopped individuals and groups from coming together to experience the joy of arts events. We're very proud to be able to present a varied and interesting festival with our wonderful speakers from First Thought Talks embedded within it. And a particularly warm welcome to our online viewers who will be joining us live throughout the series today, tomorrow, and next Saturday. Remember, you can watch all of these talks later on the GIAF channels or listen to them on the GIAF podcast pages on the website. First Thought Talks are presented in conjunction with our education partner, NUI Galway, and we're very happy to have them as our partner. Our first talk today focuses on the subject that is on everybody's minds at the moment, the pandemic. And what we're going to do is look back. As we struggle with a global pandemic which has turned our lives upside down and resulted in death and serious illness for many of our citizens, we need to look back at the last time this happened, 100 years ago. The so-called Spanish flu, 1918 to 1920, killed up to 50 million people worldwide. To discuss it and to compare it to the current outbreak, we're lucky to have Dr. Ida Milne, whose book, Stacking the Coffins, is the definitive account of its effects in Ireland, and Fergal Bowers, whom all of you know as RTÉ's Health Correspondent, who gives us reassuring updates every evening on the virus's progress. Even when the news is not that reassuring, he manages to make us feel safe. Our moderator will be Dr. Caitriona, one of Ireland's foremost social historians. She has done pioneering work on nuns, on women's domestic work, on social change in 19th and 20th century Ireland, and a fascinating book on letters to Irish women's magazines in the 20th century. She has created a comprehensive view of ordinary women's lives over a long period and set a high bar for future research on the subject. She will guide our eminent speakers through the thicket of pandemics then and now.
Thank you, Caitriona, for the introduction. Talking of the flu, just a word to begin to get it going. I remember when I first heard about the Great Flu of 1918, 1919. I was at the dinner table in my grandfather's house. I must have been 8 or 9, and there was some kind of a flu epidemic on at the time. And my grandfather was one of those very opinionated old men who was constantly deploring the softness of modern life and modern youth. And he said something like, "Flu epidemic, you don't know the meaning of the word." And he went on to describe how he, as a young man, newly arrived in Limerick City in what he called the time of the Great Influenza. I learned later it was 1918, 1919. He described seeing 5 funerals following each other up William Street in Limerick on their way to Mount St. Lawrence's Cemetery. And I suppose that image has always stayed with me over the years, although I suspected for a while it might have been exaggerated because he wasn't above telling a tall tale. But no, it has been corroborated since then by accounts of scenes in Glasnevin, in Dublin, and so on. And then when I first heard about COVID, I suppose I was like a lot of people sitting in my front room with the news on, hearing about something happening in a faraway country, and thinking, oh God, the poor Chinese, and never really thinking it was going to come to our shores. And before we knew it, we had those very frightening images of the army trucks bringing the coffins for burial in Italy. And I was reminded again of my grandfather's story. So, bringing us back to the beginning of the pandemic, I suppose, what I want to, my first topic here today, and I'd like both people to talk about, I'll start with Ida because it's chronologically, how the story broke and built. How did people apprehend the pandemic, the flu pandemic of 1918-19, when it started? We all know with COVID, and Fergal will talk about that in a moment, that there was a lot of maybe misinformation with the best will in the world, there was myth and so on. What was it like, Ida, when the story, when the word came out first?
When this story began to break here, we saw the stories, the news stories coming from Wuhan, the fears that it had spread further, and then gradually it got geographically closer to us. I was immediately struck by how parallel the stories were, because a lot of the sources that I looked at were newspapers, and the newspaper coverage was something I studied intensely, because the sources were very rich from it, because there was a very good press around in 1918, 1919, very robust and strong international and domestic press here as well. Our regional and national newspapers both covered it extensively, particularly in the areas where it hit worst. So they would be talking constantly, even in the local press in Ireland, about, that they say this disease which is affecting the armies at the moment. Or they tell me that De Beers has shut down at the moment, or the Canadian Stock Exchange can't operate as usual because it's been so hit by the flu, or that crops in some country. So it was very similar, that the way society shut down, but then in a kind of natural way, whereas here we had a more conscious lockdown because we were able to transmit to people more quickly through the broadcast media. About what was happening. So it was very similar. The echoes were very strong and very quick with it, I think, as a news story.
And, where people were saying it had started in, of course, that was all later. It had started in Kansas. It started in your own theory is that it began in the trenches? Isn't that right?
I think so. There's two major origin theories with what's, of course, misnamed as the Spanish flu, because people say that Alfonso XIII, the King of Spain, and about 3,000 of his courtiers got it, and that was reported in the Spanish press, but they weren't involved in the war, so that they had no newspaper censorship. In Ireland, there wasn't much censorship of the newspaper, in the newspapers of the flu, but there was quite a lot in other countries, including Scotland, actually. There's very little coverage of the flu in the Scottish press, which has impeded the development of Scottish history of the flu. But people weren't reporting what was happening to the combatant armies, and they were already laid waste by the flu by the time, because they wouldn't want to give away the enemy an advantage by knowing where to attack if the troops were sick in a particular area.
And you were saying about the proximity of animals and human being life in the trenches. You were living up alongside the animals you're going to be killing. And something like that.
And a lot of the live food to feed the army was live at that time. So you would have soldiers in close proximity with geese and hens and pigs, all of which can be vectors of influenza. So John Oxford, the virologist, his theory is that it really started in the very closely confined quarters of the trenches, whereas there is also a theory, of course, that it began in Camp Funston. Very appealing theory, that you can actually find Albert Gitchell, patient zero,
origin.
But I think at that case, there is an international influenza research community, and we would think there are earlier cases than that to be seen around the world.
Right. And Fergal, the whole story of COVID, how it started, or even just the origins of it, your own ideas about that, where it began, and how we here apprehended it and how we covered it and so on.
Well, it's interesting you're talking about, we don't have a patient zero yet in relation. There's suspicions, obviously, and there's Wuhan is where it started. But you'll all recall that in late December, everybody was going about preparing for Christmas, preparing for a new year. No one had heard about COVID-19, and we were only starting to get information in very early January about the first cases coming out of Wuhan, and it did seem like a distant problem that certainly Europe didn't have to worry about too much for the moment. But obviously, with the scale of travel, it didn't take very long at all before the first cases arrived in Europe, and those scenes in Italy. And it is true, I mean, those visual scenes of the trucks and people suffering really did shock people. And once it was on the shores of Europe, it was inevitable it was going to come to Ireland. Now, no one had ever heard of the National Public Health Emergency Team either. It's now probably the most famous acronym in the country. It's as well known as any other agency. The individuals are national figures, their identity is, but it was, I suppose it was rejuvenated. It had existed for many, many years because it was actually dealing with hospital-acquired infections and other problems like that. But suddenly, preparations began for the arrival of coronavirus here. They knew it was coming, and they were preparing for it. And there have been pandemic plans here in place for many, many years, because we've had previous pandemics, but nothing like what has been seen here. So they did prepare for it, and I remember it was a Saturday evening, February the 29th. I was actually at home because the news broke very, very late. I think it must have been about 10 to 9 in the evening, just before the 9 o'clock news. And we got word that the first case had been identified in Ireland, and it was a male, we were told, from the east of the country, recently returned from Italy. So within a few minutes, we had to get on air. Now, I had to do that broadcast on the phone because it just wasn't physically possible to get into RTÉ. And at that time, on that first case, there was no one available from the Department of Health or others to be interviewed. And that was probably a bit unsettling in terms of the news, because the way it came out at that stage, it was on the phone. People were desperate for information, very worried that the first case had come. And when the first cases started to emerge here, there was very little information. For reasons of confidentiality, part of that. And also, we didn't have the information we have now about the age, the location, whether they had underlying conditions. So there was a lot of fear at the start. When those first cases came, and then we had the first death was reported. It was March the 11th. It was an elderly woman. She had underlying respiratory problems. She died. So the first death then really brought it home to people that this is a virus that is circulating, but it's also going to cause terrible suffering in so many ways for people.
And I remember the whole underlying condition that a lot of us in the early days kind of seized on that and thought, oh, thank God I don't have an underlying condition, so I'm all right. You know, and then it became apparent to us that actually it was affecting far more people than that. And it was alarming, really, you know, so you had to kind of, and there were a lot of, I think, myths going around as well, weren't there, Fergal?
Well, there was
sort through a lot of that.
Well, mainly because this was a brand new virus. No one had heard of this before. And the experts were trying to get a grip on it and understand it. And obviously experts had to come on television, had to come on radio, but there was a lack of information for them too. And on occasions, you would have experts disagreeing on certain points. I mean, the big areas of disagreement were, firstly, masks was one big thing. I mean, in the early stages, the National Public Health Emergency Team and indeed the World Health Organization weren't very convinced that wearing of masks was an absolute necessity. There was a medical view about it that it might cause people to have a false sense of security, that if they're wearing a mask, they won't do the social distancing, they won't do the hand hygiene. So, and also there wasn't sufficient supply, I don't think, of masks either. So if you're going to recommend or require wearing of them, you'd have to make sure they're available to people. And in the first instance, you wanted all masks, obviously medical grade masks, to be available for the health staff who are on the front line and were heavily exposed, as we know, to the virus. But that shifted later on when the WHO came to the view that certainly for vulnerable people and older people and those with certain underlying conditions, that the wearing of a mask, ideally a medical grade mask, was necessary. And then eventually, you know, the view from the department and then the regulations were, as we see it every day now in our lives, the required wearing of masks. I mean, other countries have moved beyond where we are. In France, there's a requirement to wear masks in the street. Over in Lanzarote, you have to wear them out and about in the street in the heat. So we haven't got to that yet, but that could happen. Masks was one thing. The second issue of disagreement or debate was, should it be 1 metre, should it be 2 metres? Now, I remember this vividly because at the Department of Health press briefing, on the ground, they had a sticker saying, you know, stay 1 to 2 metres. So there was a huge debate on social media and elsewhere about, well, am I okay with 1 metre or must it be 2 metres? And then the science behind that as to whether 2 metres was the absolute minimum to stay away. They finally settled on 2 metres, but that was a debating point for weeks and weeks and weeks, again with experts arguing the toss. And when the public sees experts and people not on agreement, that causes confusion and it's a cause for debate. Yeah.
But I'm sort of glad at the same time that these debates are happening out in the open. You know, I'd hate there to be a party line. I'm glad it's good to see. I think it's good for us to see experts disagreeing because we're kind of able, it treats us like intelligent human beings, you know, there isn't just one thing that we're told. And of course, doctors would differ as well. And some of the cures that they had, or the preventive measures, IDA, back in 1918, 1919, there was quite a lot of controversy about them too, wasn't there?
Yeah, curiously, one of the main medicines that was used in 1918 was quinine to reduce fever. And quinine, of course, this is, the word is gone, the hydroxychloroquine,
yeah.
is also an anti-malarial medicine. So that there were echoes of that then and now for doctors looking at what cures might have been used in 1918 too. Whiskey and brandy were really used in abundance because doctors really couldn't agree on the medicines. They were using things like sleeplessness and a really bad headache were part of the feature of the flu. And so they would use some preparation of opium for the sleeplessness. They used aspirin to reduce the headache rather than the fever, curiously. But aspirin, of course, was made by Bayer, which was a German company, and particularly in America, they thought, there was a rumor went around that Bayer had infected the boxes of aspirin with the flu as part of the war methods, which was, you know, totally made up, but it did travel as a rumor.
That's like the myth that the whole thing was grown in a laboratory in China. Do you remember that myth that was circling among the far right kind of, that COVID was?
I think a lot of that came out of America, and particularly out of President Trump as well, too.
The more extreme,
I mean, people will always look for blame somewhere. And I think it's one of the most unhelpful elements of an outbreak like this or a pandemic, to look for blame. I mean, no one's to blame for this. And obviously, you had in the early stages in Ireland, the most vulnerable groups like nursing homes. There was a problem there. I mean, I suppose it attacked nursing homes, and they were such a vulnerable group for a number of reasons. The nursing homes themselves weren't all prepared. They didn't have enough access to personal protective equipment. Staffing levels reduced, or some people were out sick because they were ill, or didn't come into work because of fear, or there weren't enough agency staff. And the HSE was also recruiting staff that would otherwise maybe be available to nursing homes. So it needed to bolster its services. So there were problems there. And also in the early stages, the official advice was that there wasn't a need for national restrictions on visiting nursing homes, people making visits. That did change. Now, the nursing homes themselves sort of announced a unilateral sort of ban on visiting, but at the Department of Health NEFIT briefing that evening, the official view was that was not necessary. So you had a differing view there. Now, again, it's no one's fault that people become infected, and no one's looking to blame. There are lots of modes of transmission, and a lot of staff who work in nursing homes, they do share accommodation, and visitors, it will get in, but we also didn't realise the scale of which this virus could be transmitted by people who are asymptomatic. They don't show any symptoms. Up to 40% of people with coronavirus don't show symptoms. And that wasn't totally understood or seen in the medical community. So thereby, there were quite a number of patients who were being discharged, older people from hospital to nursing homes, to free up beds, certainly in hospitals, but also it was felt that they were clinically suitable to be discharged. But unbeknownst to doctors and nurses and other staff, some of those patients were infected and were being moved to nursing homes, and an outbreak would occur.
One of the interesting echoes I found between what you're talking about now and also your own reportage on RTÉ was the idea of trust and the idea of creating a kind of confidence even when we don't necessarily have confidence because we don't have evidence, or we didn't have evidence-based medicine on this, on which medicine really relies until very recently. And the very first article I actually wrote about it was kind of, this feeling came up in me very early on. I think it was the 6th of March maybe. I wrote an article in the Irish Times about the need for confidence measures, that the governments around the world really had to find a way of instilling confidence and building trust with the public so that they would get compliance for the measures. And I think one of the things that happened here, well, in Wuhan, the thing that happened was the building of a hospital within 5 days was a great local confidence instilling measure. But here, I think that public NEFIT broadcast which you and then other reporters would cover afterwards, was a great way of building trust and creating a relationship with the public over this, because there was an openness.
Because you have faces. I mean, everyone got to know and hear and see Dr. Tony Houlihan, the Chief Medical Officer, and now his acting successor, Dr. Ronan Glynn, and Cillian de Gascoon. And the other issue is that public health is an area that doesn't get a lot of attention or coverage, because everyone knows their own GP because they get the personal treatment, and they know particular surgeons because of an operation. But public health is a different matter, because public health doctors deal with population groups. They're well used to dealing with outbreaks, measles outbreaks, and vaccination programs, really crucial areas like that. But they're not the front page, they weren't up to now the front page story or the main news item, but they have become central, certainly, to government advice and individually very well-known figures. And it's probably brought a new understanding of that specialty in the profession, which is still looking for consultant status at the moment. But this may help as well, because they've been relied upon to give steady information. I think the point you're talking about is very important. Like, even on the days, I remember particularly the day when the highest number of cases was reported on one day. That was 1,068 cases, which is an astonishing figure to give out. The way it would work with these briefings is you might get that information a minute before going to air. So you'd often get a sheet of paper, and you'd be going to a live point. You have to get to the live point, read the figures, understand them, get some context around them. But putting out a figure like that, you need to have a sense of calm about it. The other high figure a day, very, very, very sad day, was when 77 people had died. Now, the fact was, of course, not all those deaths happened on the same day. Some of them were late reporting, and so you have to explain that to people. Even now, even during this week, we had a death reported, but that goes back to June. There's some late reporting issues there. So just to get an understanding of that, and now when we look at it, we've much more understanding about this virus. There should be less fear. There still is anxiety, but the flood of data and statistics and information you can get now, even on the COVID app, is amazing. It should be reassuring to people. I mean, you can look at counties in Ireland where there's very, very few cases, tiny numbers. And then you look to the hospitals, to the serious cases. So while people do get wrapped up in the daily figures, and I think that's something that we're going to move away from a bit, because it doesn't tell you the story anymore, really. The daily figures, the long-term trend is what you want to look at. 2 weeks of figures is a very important sense.
That's true, as long as a wave is in abeyance, but it becomes more important as if a wave, if we come to a crest.
It does,
again.
if it rises again and we see the sort of figures that we were seeing.
That's something you can see very much in the 1918 newspapers, is that the interest in the news media rises and fails. Like, the war will come to prominence again, and that's a real sign that flu is in abeyance in the community. And then again in October 1918, when it comes in a second wave in Ireland, it's back at the top of the news again, even though the war is quite strong. Obviously, it's coming to its dying day.
Can I ask, Fergal, you mentioned there about how the hitherto, I suppose, unglamorous figures of the public health doctors, the preventive medicine people, how they come to the fore in this crisis, and how we know them all now, and how good that is. Did something similar happen in 1918-19?
Oh, yes.
Were there, there was Sir Charles Cameron, of course, but there were a few other figures too. But weren't the doctors kind of badly treated as well?
Well, in 1918-19, the doctors had been running there was a long-running fight with the local government board for Ireland to pay them decent wages, and they had really bad terms and conditions, and each poor law union would decide the pay for the doctors under their control. And the flu actually gave them a bargaining power that they'd never had before. So they were able to negotiate. But during the peak weeks of the flu, as a doctor was very much part of the community then, because they would be in the local dispensaries in each small town, and then of course in the poor law infirmaries as well. And they were really running the show, and about 70% of the population of Ireland then really had free medicine under the
Dispensary doctors.
under the dispensary doctors. But the doctors weren't well paid. They had huge areas under their control. I can see evidence of doctors going to houses at 3 or 4 o'clock in the morning. There was one doctor, Dr. Rafferty in Bray, who at the peak weeks of the epidemic, he was treating maybe 500 patients a day. And, you know, the phenomenon of trying to do something like that is just huge. And a one-man operation, essentially. You know, you're going around to visiting all these houses. There was 100,000 extra home visits by doctors from the poor law dispensary doctors in the flu year, which is essentially April 1918 to April 1919. But they did, some doctors even died because they had no pensions. They died in the, I've forgotten the word.
Workhouses.
In the workhouses,
In the workhouses, yeah.
There's some stories of that.
Isn't it interesting when you compare what you're talking about there to what happened here, then with coronavirus? I mean, a distance was put between GPs for understandable reasons and patients. There were telephone consultations, there was video consultations.
The doctors got constantly sick in 1918 because they were dealing very much with the public. Some of them died, some of them went out of action, never came back to work again because they suffered long-term illnesses. But because also the other issue was that there were so many doctors away at the war. There was a shortage of doctors, and a lot of the doctors were older, of course, which would leave them more vulnerable to flu as well. But the locums actually, during the peak weeks, they got higher and higher fees all the time. And, you know, a fee that might have been, say, a guinea at the beginning could have been 5 guineas for a week at the end of the flu. Yes. So they really, the fact that they were getting sick meant there was less expertise, and people could charge higher fees all the time.
And of course, you know, as you say there, Fergal, people go to the doctor for other reasons. And I remember, you know, ringing somebody, having a telephone consultation. The doctors obviously in 1918-19 didn't have that option. But both of you, when I was talking to you, you both brought up points about mortality from other causes, which I thought was fascinating. And there's, in your book, for example, Ida, you make a point that for some people, the flu, for some very poor, very, very beaten down people at that time, the flu was just one of another of fatal and lethal things that could happen to you and your family. And that, does the flu in 1918-19, does it replace any other diseases? Does it elbow them out of the way? Or is it just one other?
I think what we'd call is that it reaped early for some diseases. So people, like you see the numbers from TB fall the following year. Numbers of deaths from TB fall the following year because the people who might have died the following year have died earlier than they would have otherwise. And the same with things like heart disease as well. Sometimes it's hard to tell whether it's the flu or the pneumonias that often came with it that killed them. You know, does it kill vulnerable people quicker or not? But it also hit very strong, young, previously healthy people and felled them. And they were the real surprise cohort in 1918. And I suppose early on in this, we thought that wasn't going to be the story here, at all here, because it seemed to be killing older people, even if it infected younger people. But of course, the disease can't change. We don't know what's going to happen with it yet. We can't really count what happens in an epidemic until it's over.
That's true, because I mean, in terms of, I mean, there have been some studies here, but again, we're in the middle of it. We see that the excess deaths due to COVID-19 were initially estimated for the period of March, April, May at about maybe 1,200. 1,300. Now, the Central Statistics Office has done a more recent analysis of that, and it's revised the numbers downwards. So the belief at the moment is that the number of deaths that occurred, excess deaths that occurred due to this virus, is between about 800 and 900. But what they also found, and it's not totally understood yet, is that deaths from other conditions reduced also. Probably, if you think about it, because people were self-isolating, they were at home, there were fewer accidents, seems to have been fewer heart attacks. Perhaps some people were less stressed at home or in a calmer environment of a house. But so overall, deaths did drop. However, the health service is now seeing a return of delayed conditions, pre-cancers missed, perhaps cancers delayed. So we don't, as you say, we don't have a full picture of what's really happened. In Kildare, for example, there was a fascinating study done by the coroner for Kildare, Professor Dennis Cusack, which found a 6-fold increase in deaths of people in residential care institutions, in nursing homes in Kildare over those few months. That's quite a staggering figure.
Actually, Kildare, talking of Kildare, that was one of the worst hit counties. Kildare is unusual, isn't it? I mean, and you'd imagine, well, you dismiss the idea that that's necessarily because of the Curragh camp, but Kildare had one of the highest mortalities in 1918-19, didn't it, in the country?
Yes, it did.
And Donegal as well. We'll talk about Donegal in a moment. And now here we are with Kildare again. And, you know, very often when you look at kind of crime and things as well, Kildare is high. Kildare is sort of different, you know, it's unusual. I'm not offending, I hope, any Kildare people.
And I live in Kildare.
I know. With all due, I mean, I think it's just very fascinating. Yeah. Do you want to say a few words about that? Both of you, maybe.
Kildare,
maybe
I think one of the interesting things about Kildare is that it has a great connectivity to the establishment in 1918, 1919, to the government, because a lot of the higher-ups would have lived out in Kildare. So a paper like the Kildare Observer, which is a newspaper of the elite, you know, it's really what we call a castle paper. And so that there is that connectivity, but also it's very close rail and canal links to Dublin. That's another reason. But one of the things I was always trying to emphasize, I felt a bit like a witch sometimes during particularly the early weeks of what was going on here with COVID-19, because, you know, from the research you could kind of predict what was going to happen next or have a reasonable guesstimate at it. And I was saying that anything unusual that happens, like I was actually onto the water authorities and said, please don't close down, because anything unusual that happens in 1918, 1919 caused deaths to rise. And one of the reasons I argue that Kildare had a higher rate of death, it had the highest county rate of death in the 1918 flu, was because there was limited water supply to the town of Naas in particular. And also because the gas company, which supplied power and heat and light to the town, they were really badly affected by the flu. And of course, the other thing being that the gas company found it hard to get supplies because gas came from coal. And coal was in really short supply as well. So the newspapers had to run with blank pages. At certain times, people had no power in Naas. So, you know, part of, you also need water to wash your hands, to provide hygiene, but to hydrate. So it's really, really important.
Cook, yeah,
so
all those things.
When you see a black spot in the 1918 flu, it's generally caused by something like that, like a lack of water, a lack of power, or else perhaps a big funeral in the region. And there was also a big funeral, there was a few big funerals because not just in Kildare, but in Louth in particular, I think I remember a few, when somebody in the community who might be a strong nationalist would die. They'd have a very large funeral with maybe 4,000 or 5,000 people, and you can imagine what that would have done.
Just on a little aside there, I think one of the reasons perhaps in Ireland that we don't remember the flu officially, perhaps as much as we could, although it's there in lore all the time, that comes across in your book, and it comes across in my family lore as well, is because all of these things are happening the time of the big Sinn Féin election, 1918, where Sinn Féin routs the Irish Parliamentary Party, in December 1918, all the things that happened in 1918, the conscription crisis, the big push, the various other things to do with the First World War, and then 1919, the first Dáil, Salahad Beg, the War of Independence. There's so much else going on, you know, that we can, and all this and the flu as well. But you also, before we get on to Kildare nowadays, and you also mentioned Donegal as a black spot.
Yeah, and it took my great colleague Patricia Marsh, who studied the flu in Ulster, and we spent a long time puzzling this out. And we thought at first it was because of seasonal labour, because Scotland and Donegal would have strong labour contacts, and that people might go to Scotland, that somebody would die from the flu, that be brought back by boat with all the family on board, and that then the Donegal wake would happen, and that would spread it further into the community. And then I got the wonderful good luck, somebody found me Kathleen McMenamin, who was then, I think, 106 years of age at that stage. She died at 107. And she had lived in Rathmullen on Lough Swilly as a small child. And her mother had been a nurse in the community, or had nursed in the community, people with flu when that happened there. And I said to her, was this the reason? She said, oh no. She said, the reason I think it happened was because of the Navy being stationed in Lough Swilly during the war. Yeah. And they were taking shelter and protecting from the U-boats, because these waters, the waters all around the coast, were absolutely rife with U-boat activity at the time. And she said, I then started to ponder why the same thing hadn't happened in Cork, where the Americans were based in Queenstown or Cove. And I think the American troops were treated on ship for the most part, whereas the British troops came into the community, she said, and were treated locally by the local doctors and things. And she said they spread it that way.
I wondered as well, going back to Kildare, if the bloodstock industry had anything to do with it either, but Kildare nowadays then, Fergal, it was the meat factories, was it?
Well, certainly.
Pretty much.
I think the proximity to Dublin as well too is a major element, and the commuting that occurs. And we have recently obviously had the meat factory, which have their own difficulties there because of the closeness with which people work, sharing accommodation, the nature of the employment status. It can be quite clandestine, and quite difficult to identify people, and they're reluctant to be interviewed mostly, and you can understand that. But if you're looking, like when you look at flu now, on a typical year in Ireland, around maybe 250, 300 people will die now from influenza in this country. But on a really bad year, really bad year, you would see, because it takes a while to see all the numbers, you could certainly see 800 to 900 deaths from influenza here. Mostly older people, but then of course it also does affect younger people too, and that goes back to times you were talking about as well too. But because there's vaccination now and there's protection that can be got from it, people probably don't think too much about it or aren't fearful of it as much as they used to be, because unlike coronavirus, there's a vaccination and there's treatment for influenza now, which makes a big difference.
I think we've all got a little bit blasé as well about mortality. We do feel in many ways that we're immortal, and while we're fearful in ways perhaps that people in the past weren't, it's extraordinary that we can be knocked off our feet, metaphorically speaking, I suppose, by this knowledge of a deadly virus.
That's one of the reasons why I started doing, after I'd researched the flu, I moved on to looking at infectious diseases of childhood, because I realised that when I was interviewing people, I did a lot of oral history interviews on the flu. People would also tell me that, Daddy's brother died of the flu, but he had 2 who died from TB and 2 who died from measles and 2 who died from diarrhea. And so I realized that there was a whole story that we haven't told in that. And one of the reasons I think why we saw vaccination hesitancy begin to grow in the 90s was people had forgotten those stories.
Yes.
And they weren't aware that, for example, in any year in the 1910s, that 20% of the mortality, 20% of the deaths, about 70,000 on the island, was of children under the age of 5. And many of them were from infectious diseases of childhood, like whooping cough. Bronchitis was a huge killer. Pneumonia, of course, was a huge killer. There was no vaccination, no antibiotics in those days. But measles and mumps and, all those diseases.
It explains a lot of parenting practices of those days, which might somehow otherwise seem incomprehensible to us. For example, children being sent away to the country, children being sent to their grandparents. Yeah. That grandfather I was talking about, when he arrived in Limerick with my grandmother, they left their infant son up in rural County Offaly with his grandparents. And the grandparents got so fond of him, they didn't part with him for years. But my aunts and uncles and my mother would always say they shouldn't have left him up there. But they left him up there because they were coming down to a flu-torn city. And, you hear oftentimes about children in autobiographies, children being sent away and for their own protection. People were
That
pragmatic.
happened now too.
Yeah,
You know, you could see, whether the husband and the wife were both doctors, where the two parents were doctors. They thought for a while to send the children away, or what should they do? Should they keep them at home? Should they send them out?
Yeah, you can see
because
why.
of course the childcare issues as
But
well.
people were very aware of, and they were aware of cleanliness as well
Yes.
then, and of washing hands and so on. They didn't have all the things we have.
Bacteriology was the new wonder kind at that stage, and the rates of death from infectious diseases were dropping quite rapidly in the 1910s. And 1918 would have had the lowest rate of death from all causes at the time on record, had it not been for the 1918 flu, because we were going through what we call the epidemiological transition, where you see all these rates of death from infectious diseases dropping, because people are getting, even the ordinary person is getting better knowledge about hygiene. Because of the effect of Lister and Koch and
if you read any of the little booklets that were brought out in the early 20th century, aimed at working class farming Irish women mainly, and they're all, you can interpret them one way as kind of, prescriptive literature telling women what to do, but they're all incredibly practical and doable.
Yeah.
Wash your hands, open the window, move the dung heap away from the house. And people implemented these.
Scrub the table down with bleach.
Yes, and people kind of implemented these, and women, they took to them like ducks to water, because people are not stupid, and they will obey this. But do you think, Fergal, that we were maybe a little bit more cavalier, that it was harder to get the message across nowadays about those kind of things? I sometimes felt it was.
Well, you can get information everywhere now. There's no shortage of it.
Yeah, that's the trouble.
But there's probably too much information, and it's genuinely confusing. There is information overload, and I think, going back to the start when there was so little known, so much is known even now. Look, you're talking about vaccination. Look, the big hope, the WHO's saying today, hopefully by mid-year next year, there will be a safe and effective vaccine, and people would hope for that, because in terms of vaccination for all the diseases and illnesses you've been talking about as well too, that's been one of the biggest progresses over the years, and people buying into protecting themselves and protecting others. And we've heard so much talk about herd immunity in recent months. And then the benefit, obviously, of vaccination, whereby people who get vaccinated build up protection in the whole community, and you're protecting others. So it will be interesting to see, what happens with a vaccine. We really don't know, but hopefully that will come, and then it'll be about ramping up production and it being available in Europe and available to people. That would change things, though, radically. I mean, it would change our world completely if there was a really effective vaccine that worked across all age groups, ideally. You might find a vaccine that's excellent for certain age groups, doesn't quite deliver the immunity for others. So there's over 100 in trials, some at very advanced stages. So fingers crossed that it works. But you do have to convince people and talk to people about vaccination. You're talking about vaccine hesitancy. We've seen it over the years in a lot of vaccination campaigns, and some controversies both abroad and here resulted in a drop-off in the uptake of vaccination. But I think the shock of this virus now, you'd hope and probably expect that if a vaccine is available, that there would be significant buy-in to it by the public.
That's it, yeah. And I was thinking as well, about the whole lockdown idea. There was controversy in Europe about lockdown. As you know, Sweden didn't implement one pretty well. They really did, to a certain extent, but they didn't really. Their mortality rates were higher. There was a belief that, herd immunity would be required, or not so much immunity, and 1918-19, I know some schools were closed. I know people were discouraged. But was there ever any talk of the kind of, or could there have been any talk of the kind of lockdown?
I find that a fascinating question. And the other thing is, I think each region behaves according to tradition, whether in 1918 or now. Sweden didn't close down at all. It didn't shut the schools in 1918, whereas we did here.
Yeah,
and we shut them during the peak weeks of the flu, and it was one of the very first actions Sir Charles Cameron, that wonderful then 88-year-old Dublin medical officer of health, advised on was the closure of the schools, because children were believed to be super spreaders, and that it was kind of termed. But I suppose when I look at a super spreader in terms of a child, I think of somebody that a parent picks up and that you pass around to the next. And so it's easy to see how they are super spreaders when you think of them in terms of how we interact with children within the home, and then why that might affect that young adult age group as well. But they closed down the schools. Maynooth was closed for a while, the seminary. Clongoweswood College has very good records. I love places that have very good records. And they didn't shut, but they isolated the school and didn't let any of the staff go to funerals in the community or anything like that. Or at least in theory they didn't. The staff some of the funerals in the community were organised after dark, so they wouldn't be caught doing it. And they did things like having the sick pupils fed after the well pupils at two different sessions, and also lowering the load of school lessons. They put on more film shows and things like that and reduce games as well, and tried to, of course, airing. This is something we have to focus on, I think, a lot more now, is airing buildings. They aired the buildings a lot because, you know, that they shut up the windows, and cold air therapy and outdoor air therapy was considered very important in 1918.
Didn't someone say recently, Fergal, as well, that when the schools go back, they should not be overheated, the windows should be open, the fresh air should come in?
I mean, that is the advice. Now, look, it's going to be difficult in the winter when we get very cold air, but the good ventilation is really important. In terms of lockdown, I mean, the first lockdown was also a shock to people, I think. But I don't think there's no appetite, certainly, on the National Public Health Emergency Team for a national lockdown again. It doesn't look like that would come. But what you could see is localised or regional lockdowns. I mean, if it came to that, but nothing on the horizon at the moment, based on the figures there at the moment. But if no one knows what the winter is going to bring. You're going to get the mix of influenza and colds alongside coronavirus. And which is which. All the more reason why, I mean, there will be a strong campaign for people to get vaccinated. Children aged 2 to 12, that campaign's going to, through a nasal spray, is going to start shortly. And then older, more vulnerable people, the normal vaccination program. And it will be, I guess, really important that as many people get vaccinated to help doctors and other staff to be able to rule out pretty much that it's you know, that it's not influenza, it is coronavirus, because the pressure that will put on the system could be quite enormous.
Caitriona, can I just get back to that idea about quarantine that you're raising at the beginning? I'm really surprised, because the concept of quarantine is like maybe 500-600 years old, maybe even older. You know, that we have it from Italy and plague, and then earlier I think from Persia, but that we never considered quarantine for us as an island. It would have seemed a very obvious thing to do in 1918. And I think the reason for that, and I still have to find evidence, so I'm being a bad historian here, I'm speculating rather than looking at evidence based. I'm throwing out a question, hoping somebody will find me a little shred somewhere in the war papers, is that the reason we didn't do that was because the war was at a really critical stage. And at that stage, when the flu was beginning to emerge, it looked like Germany was going to win the war. And they were escalating the U-boat activity in the Irish Sea in 1917, 1918. It had forced America to come in, and a lot of the American air bases were in Ireland. Like the whole south coast was essentially, you know, littered with American air bases of different types, from West Cork to Cork itself. Wexford had an air base, Waterford had an air base as well, and you know, that we were really key, that this American activity in Ireland was really key to controlling Germany's efforts to win the war. And I think eventually somebody's going to find me a little gem in the War Office that proves that theory right. But I'd love if it was done sooner rather than later.
Well, we were part of Britain administratively as well. You know, remember the election at which all men over 21 voted for the first time, and all women over 30 in December 1918. That was a British UK election, including Ireland, you know, and we were part of Britain, and people were going over and back an awful lot. Like the Leinster, for example, the tragedy of the Leinster and various other things that happened. The boats were flying over and back. It would have I'd say it probably would have been against.
It would have been difficult.
It would have been very difficult. And the other thing is, I mean, even if you take Ireland like as a whole, rural, generally speaking, except for Donegal and parts of Kildare, rural Ireland got away with it a little bit more, obviously, than urban Ireland. And people were probably semi-locked down anyway, self-sufficient, providing all their own vegetables, all their own water from a spring, only going into town for the tea and sugar, you know, and that, and even town. Although, mind you, there were markets and fairs in the towns as well. With a lot
But you see,
of
the
live
other thing
animals.
we were quite lucky at the time is we had, as a country, quite a lot of suppression, military suppression. So a lot of the fairs were cancelled.
Yeah.
And I wonder if that's why, say,
Ah.
Clare had a lower
Yeah.
incidence of flu. Clare escapes, even though it has a population of 100,000, escapes with, I think, 49 deaths, which is very low.
Yeah, yeah.
And I know nearly all of them. And,
Clare comes up as a curiosity in another context as well. I'm
Yeah.
just trying to remember. It's one of the most rural counties, I think,
Yeah.
in Ireland, the least urbanised, you know,
Yes.
and with longer, at least at that time anyway. So, so that's that. Yeah.
I often joke, probably in very bad taste, that it's to do with the Percy French song. Are you right there, Michael?
Oh,
you know,
the
it was
West
the
Clare Railway.
inefficiencies of the West Clare Railway that lowered the rate of death in Clare.
You never know. I mean, there were, but as you say, it's a rurality as well, and people, you know, not spreading as much in those areas. I'm just wondering, in the time we have left to us, talking about remembering, talk about how this will be remembered in years to come. When you and Patricia Marsh and Caitriona Foley went to write about the flu of 1918-19, the newspapers were a great source. I found that as well when I was writing a bit about the flu. The newspapers, I suppose some of the memoirs of the period, and of course you had oral evidence as well. But you also had people who, as you said in your chapter on oral evidence, that some people that you talked to actually didn't remember the flu really. It hadn't impinged on them. But you have a fairly... Nowadays, I'm just thinking, the historian of the future will be drowning
In
in
evidence.
resources,
Yeah, yeah.
in information, not just, but in images as well, you know, because we have images of the flu. And I'm wondering about that whole topic of how something is remembering, because you said something, Ida, about private remembering and public forgetting. That to you is what characterizes the 1918-1919 influenza, that it's remembered in families like my grandfather, like the people you spoke to. But there's a kind of a public forgetting of it, except if it comes up every so often about, you know. But I'm wondering now if, with the current crisis, will we be looking at a kind of a public remembering and private forgetting? Because nowadays, so much of visual media does our remembering for us or something. Just a few ideas there, if you want to address this.
It's going to be impossible for people to forget this, I think, you know, and we're not through it yet. And it's not like a hurricane or a storm where there's a start, a middle, and a defined end. We don't know where it's going. The final chapter hasn't been written on what's coming. We may not get a vaccine. So it's in some ways, it's a very, very strange world. And of course, this has touched everybody in some way. No one has escaped in this country. Families have lost loved ones, been unable to visit loved ones who are dying, which is tragic. The personal searing experience of people. You heard Professor Ronan Collins talking on television during the week, that he says that he's seeing quite a number of older people who feel that life may not be worth living anymore. I mean, that's a terribly sad thing to hear, because life has become so difficult, and the lockdown...
You know, I wonder, are there few of us who haven't thought that at some stage? You know, I live on my own, and I think it's been very stressful for people who live on their own, just as it has been, in a different way, stressful for people who live in families, because you're worried about family catching it.
It has.
And, you know, but everybody has had their own fears in this.
And they're amplified as well too.
Yeah.
And people, you know, who suffer from mental illness, being isolated, being at home, unable to access services, very, very difficult. They've only really got going again, but there's, you know, delayed access and there's limited access now. And I also think that because of the scale, even now today, the scale of restrictions and the scale of measures, in some ways, it might feel like a de facto lockdown anyway. And the reason why I say that is that some people, certainly that I encounter and write to me, feel it's too much hassle to go out now, too difficult to socialise. There's fear there. So even though there isn't an official lockdown,
I mean,
moment,
the thing I long for is a good dinner party with far too much drink, but in moderation, of course, far too much in moderation. But you wonder whether, like some people argue that the reason 1918 was forgotten was because there was so much going on so much misery between the war and the revolution and all the stress that caused, and then this even more unfair thing on top of it, which brings the war front right into the home. That's the reason that it's forgotten, is because people deliberately shut it out. And that is an argument that could be had. You'd wonder if we might do that with this as well.
I wonder, I don't know. I mean, I think the point you made about the emotional aspect of it there, Fergal, is very, very pertinent. And the people I worried about during lockdown were the children who might have been stuck at home with parents who were perhaps overburdened themselves and found it hard to make it, even with the best will in the world, to not even to homeschool, because I think children learn from their parents anyway in an informal way, but who might have been perhaps short-tempered, or, the children who missed the routine of school. And then there were old people. I mean, one of my neighbours, whose son is in America, said to me recently, she said, I might never see him again. And she's in her 80s. And I said, sure, of course you will. He'll be back next year, or you'll be over there. But I don't know that. And she doesn't know that.
It makes you realise how precious freedoms are, individual freedoms are, and how easily in some ways they can be lost. And you're talking about not being able to travel, to visit people, to see people who are dying, to go down the street, to travel more X number of miles, things that you'd never have thought possible.
Absolutely.
Became a restriction, and it will and has no doubt changed people's perception on the world. You're talking about the children going back. An amazing moment it was on Monday. I was after doing the 1 o'clock television news at the Department of Health, and when I was leaving the Department of Health building just about 1:15, I heard a sound I hadn't heard for 6 months. And as I walked out the door, it was the screams of children laughing. And there was Catherine McCauley Primary School just beside the Department of Health. And they were running around the playground, and it was an amazing sound, because up to that, you'd never heard that. And in the depths of the lockdown, there was very few people in town. The most you'd see would maybe tumbleweed coming down the street. Very few people around, very, very quiet, eerily silent. So that was a contrast, I thought. Lovely to hear. And, the innocence of it, and also the realization that the world has to get back, get back living again. You can't remain in lockdown. You have to find some sort of balance.
Well, I tell you, I can't wait to see my students again, in whatever
in the
form.
Flesh.
In the flesh. In the lovely Carlow College.
I know. I think it's quite hard on people. I think we've all discovered, some of us have discovered inner resources maybe we didn't know we had. Were they as introspective back in the day? Were there people reflecting about the flu and what it had taught them, or was it just a struggle for survival?
Again, curiously silent on that. They don't. One of the pieces I think that does reflect on it is actually The Wasteland, the T.S. Eliot poem. And that is written, in the context of the flu and the war as well. And Eliot's family had the flu. And, the whole bleakness of society and everything. And I think it's a very powerful poem when you look back and see it in that context.
I must
reflect it. But I think there was a different attitude, Caitriona. We weren't, what would you call a declarative society, and people were supposed to be stoic.
They were.
And they didn't talk about things like suicide or, bereavements. They would offer it up and treat it in a different way and get on with it.
They had.
And I think that wasn't, it was a way of coping.
Yeah, whereas our way of coping now is
to
be thinking about it and to be... So anything else either of you would like to add to the discussion about anything we've talked about?
Well, I mean, look, we're still going through this at the moment, we don't know what the outcome's going to be. You have to try and remain hopeful. I think that's the most important thing to the depths, the pain that people are feeling. You see it in social media, people finding it very difficult, very distressing, very lonely at times, unsure of where it's heading. And the one thing is, no one can tell us, no one can really tell us what's coming next, where it is. but we have better information now. People are armed with the public health advice as well too,
I
to follow.
think we can trust, and I've been lucky enough to earwig on a group of doctors and other healthcare professionals set up by Professor Oisin O'Connell down in Cork to share information fast. And one of the things I've been struck on and again there are parallels with 1918, is the resourcefulness of doctors and how amazing they were when they didn't have what they're trained to do, rely on evidence-based medicine, that they were going out and saying, what can we do? Where can we find good, reliable information from? How can we inform ourselves about this? And you can see, I think, I don't know whether it's fair to say now, is that they have gained, they're not as, they're slightly calmer about it now, I think, than they were before, provided we can keep the numbers low, that they're being able to treat it better in hospitals. They have better knowledge of what's needed to do. And that happened in the flu in 1918 too. They got more confident about the treatments that they were using, because sharing knowledge is key to everything.
Yes, they have. I mean, the big debate was to eliminate it, suppress it, kill it off. But I think there seems to be, living with this, with the lowest numbers that can possibly be achieved, appears to be the strategy to get us to a point where there are certainly better real treatments, and then a vaccine seems to be the current position. I don't think there doesn't seem to be any groundswell support amongst the health officials for the zero COVID island approach, where you absolutely bring it down to 0 cases. Now you have to implement quite significant measures to get that, and we're a very porous country. We've got the border as well too. It seems difficult to do that here, and the one issue like travel has been kind of left be. The number of cases from travel, we're told, appear to be quite small. I think it might be 2 or 3%. So it is low-ish. So, but I think that appears to be the strategy for the foreseeable future, in as much as you can foresee the future.
And I suppose, just to wind up, maybe we have to hold on to hope. We have to, if we can, learn from the lessons of the past. And COVID, the virus seems to be getting a little less harmful, a little less virulent. But somebody said to me that it'll be a very foolish virus that keeps on killing their host. So, we have to kind of watch out for the mild versions of it as well. I think on that note, perhaps we could finish up this session. And thank you, Ida, and thank you, Fergal, both of you, for bringing really your very different sets of expertise to bear and being able to talk to each other as well. Caitriona, do you want to say a few words?
Thanks, Caitriona. So, thank you for watching our first session of First Thought Talks, which has educated us wonderfully about the pandemic in the past and the pandemic now, and sets us up beautifully for our next session at 12:30, when we'll be joined by a panel of current experts on the pandemic with quite differing points of view in some cases, and you will educate yourself further there. Thank you for watching, and do join us at 12:30.